Hey, welcome back. Today we're going to talk about the heart structure in different parts of the heart, the vessels that go to the heart, the vessels that go to the lungs, and what's the overall job of the heart in the cardiopulmonary system. So let's get started here. All right, when I'm drawing my heart, I like to draw it like this, okay? In the middle here, we've got our septum. Let me make that a little bit straighter here. Okay, in the middle we have our septum. Now, we have a big vessel coming off over here. And this vessel is going to be our Vena Cava. Let me try that again. This vessel is going to be our Vena Cava. Okay, if it's coming from the top, it's the superior vena cava, and actually you have some coming from the bottom that connect on the back side of the right atrium, and that's going to be our inferior vena cava. Now, on the top here, we have our right atrium, and the job of the right atrium is to just receive the blood that's coming back from the body, receive the deoxygenated blood that's coming back from the body, right? And down here we have our right ventricle, okay? And the job of the right ventricle is to contract and create enough force to get that blood through the lungs. So after the right ventricle here, we have a vessel that's called the pulmonary artery. Pulmonary artery, right? And this is going to the lungs. I'm not going to draw the lungs because it wouldn't be very good. Now, separating the right atrium and the right ventricle, we have a valve here, kind of shaped like this. It's got 3 leaflets. It's called the tricuspid valve. And the tricuspid valve's job is to prevent blood flow from going, when the RV contracts, to prevent blood flow from going back up into the right atrium. Okay, so when the RV contracts, this valve closes to make sure that blood flow goes from the RV into the pulmonary artery and into the lungs. This tricuspid valve is connected to the papillary muscles of the heart, of the right ventricle, and then you have strings that attach to each leaflet. Lots of little strings that attach to each leaflet. Okay, and just so you know, these parts of the wall, the muscle is called the papillary muscle, and then you have the strings, which are the Chordae Tendineae. So these guys right here that are connecting the papillary muscles to the tricuspid valve leaflets, those are the Chordae Tendineae. So the job of that is to prevent, when the RV contracts and the valve closes, is to prevent prolapse. So preventing that valve leaflets to go into the right atrium and blood flow to go back. All right, let me get rid of those, get a nice clean look here. So blood flow goes from the vena cava, which is returning to the body, into the right atrium, which is just pretty much a sinus cavity for blood to return to. It doesn't, it's the weakest part of the heart. It doesn't really contract that much. And then from the right atrium, when it contracts a little bit, opens up that tricuspid valve, blood goes down into the RV. And then between the RV and the lungs, we have another valve, and that is the Pulmonic Valve. Okay, so this valve right here is the Pulmonic Valve. Now, that is just to prevent blood from flowing backwards, retrograde, into the right ventricle when the left atrium contracts. So blood goes through here, goes into the lungs to get oxygenated, and then from the lungs, it goes into the left atrium. Okay, so this is lungs, and this vessel here, this is called the Pulmonary Vein. pulmonary vein. So there is no valve in between here. The part of the heart receiving the blood from the lungs is going to be your left atrium. Your left atrium. What's separating your left atrium from the left ventricle is going to be your mitral valve. And it's got Chordae Tendineae strings, and it has papillary muscle ruptures, it has papillary muscle connecting those strings to the vessel wall. After a STEMI, you can get a papillary muscle rupture, but that'll be for a different video. And then left ventricle, that's your big boy that collects all the blood, and the goal of that left ventricle is to get as much blood out of it to the body so that it can deliver oxygen to the tissue. So the whole goal of the heart and the lungs is to receive the blood that's from the body, oxygenate the blood, and then send it out to the body. And you got to have enough force and enough pressure to get that oxygenated blood all the way to the head, to the gut, to the kidneys, to the toes. Okay, so, and coming off of this left ventricle is the aorta, and that is our largest artery in our body, and all of the arteries branch off of that, but we have a large aorta, and actually it comes up from on top of the left ventricle in an anatomical approach, comes up and comes over, and you have an arch, and you have your subclavian arteries that come off of that, and your carotid arteries that feed your brain, your carotids or your subclavians feed your arms, and then you got the arch, and then you got the descending aorta after that, and that goes to your kidneys, that goes to your gut, that goes to your legs and whatnot. So, and in between here we have the aortic valve, and that is just to prevent blood that closes after the LV is done contracting, and that prevents blood from going back up into the left ventricle and having retrograde blood flow, because we want all that blood flow to stay in the aorta and to stay where the tissue can abstract the oxygen in all of those vessels, right? So, cardiac cycle. When we're talking about a full cardiac cycle, let's see if I can write this down. So, a cardiac cycle, basically, it's one systole and one diastole. Okay, so that is a cardiac cycle. Basically, when the right atrium and left atrium contract together and they eject their blood into the right ventricle and left ventricle here, that is the end of diastole. And when systole begins, the LV and RV begin to contract. They push open these aortic and pulmonic valves, and then it goes into the lungs and into the body. And once those valves are done, or once the LV and RV are done contracting, and those LV or those aortic valve and pulmonic valve close shut, that is the end of the cardiac cycle. So that wraps up the structures of the heart. Write a comment and tell me what you would like to learn next. And until next time, thank you for watching.